A couple of years ago, a woman named Maya went through a series of intense life changes. She moved to a new city where she didn't know anyone, started remote work, and became a caretaker for a father with dementia. To manage the stress, she optimized her routine. She exercised almost every day, maintained a pristine diet, and went to therapy weekly. Her body got stronger and her mind became more resilient, but her overall health still deteriorated. She developed severe insomnia, waking up in the middle of the night, and spent her days exhausted, unfocused, and entirely unmotivated. Maya was following standard medical advice perfectly. I've discovered that the traditional way we think about health is incomplete. By thinking of our health as primarily physical and mental, we overlook what I believe is the greatest challenge and the greatest opportunity of our time: social health. You can run every day and sit on a therapist's couch every week, but achieving peak physical and mental fitness still leaves you biologically vulnerable if a third, systemic deficiency, is left ignored. While Maya was mastering her diet and exercise, her environment had become a vacuum. In her new city, she lacked any community infrastructure, often going weeks without spending quality time with anyone other than her husband. This wasn't unique to Maya. Globally, 1 in 4 people experience chronic loneliness, and 20% of adults worldwide don't feel like they have anyone they can reach out to for support. Disconnection triggers stress in the body. It weakens people's immune systems. This prolonged immune suppression leads to catastrophic outcomes. It creates a measurable spike in the risk of stroke, heart disease, diabetes, and dementia. Because this cycle leads directly to early death, chronic isolation can't be dismissed as just a sad feeling. It is a biological driver of disease, a systemic threat that has evolved into a global public health crisis. While physical health is about our bodies and mental health is about our minds, social health is about our relationships. And if you haven't heard this term before, that's because it hasn't yet made its way into mainstream vocabulary. Yet it is equally important. Being socially healthy operates independently of whether you are an introvert or an extrovert. It actually relies on fulfilling a precise biological requirement for both the quantity and quality of human connection. This requirement shifts over time. A college freshman might lack a sense of belonging in a new dorm. Working parents might have zero time for one-on-one friendships amid the chaos of raising children. Or a recent retiree might feel entirely untethered without their daily team interactions. Just as the physical body requires a varied nutritional diet to survive, human biology demands a diverse and specific intake of social connection. To reverse this kind of social malnutrition, researchers developed a specific clinical intervention known as the 5-3-1 guideline. First is the 5. Interact with 5 different people each week. These can be close loved ones, casual acquaintances, or even a barista. Interacting with a variety of people establishes a baseline sense of belonging, functioning much like eating a diverse range of vegetables in your diet. Next is the 3. Invest deeply in at least 3 close relationships. Trade your standard to-do list for a to-love list, and prioritize face-to-face, vulnerable interactions with the people who matter most. Finally, the 1. Dedicate 1 hour a day to meaningful connection. For those who feel too busy to spare 60 minutes, the data tells a different story. This time allocation chart highlights the discrepancy. The average adult in the U.S. currently spends 4.5 hours each day staring at a smartphone, dwarfing the single hour required for social maintenance. Surviving this epidemic means reallocating those empty digital calories into vital social nutrition. Instead of scrolling through an algorithmic feed, call a family member or write a thank you card. I know this protocol works because Maya is actually me. Despite being a researcher who spent over a decade studying this exact topic, my intellectual understanding offered zero biological immunity against the physical toll of isolation. I had to implement intentional interventions to reverse my symptoms. I scheduled recurring hangouts, attended community events, and dropped cards in neighbors' mailboxes. By treating connection as an active discipline, my overall health improved far beyond what physical exercise and therapy alone could achieve, because social health requires deliberate, proactive practice. Decades ago, society had massive blind spots regarding physical fitness. It took years before regular exercise was accepted as a basic requirement for human survival. Public health crises, like the smoking epidemic, were defeated when recognized as systemic issues. We need that same integration for social health. Education systems must implement connection classes, and city infrastructure must foster spontaneous gathering. Because the beauty of nurturing your own social health is that it naturally enriches the social health of everyone you connect with.